So during aging, production of testosterone start to decline. So your function related to testosterone start to decline. You start to have less morning erection, you start to have less strength of your muscle, you're tired more quickly. So what your body tries to do, your body tries to compensate deficiency of these functions by extra conversion of weaker testosterone to stronger dihydrotestosterone.
Welcome back to another episode of the Peak Performance Life podcast. Today, I am so excited to have someone that I have heard about for so many years from one of my very close friends. This man has changed the life of my very close friend, as well as his father and many other friends and family members, as well as thousands of other people. His name is Dr. Dzugan. D-Z-U-G-A-N, Dr. Dzugan. He's the author of 156 publications in medical journals and health-centered magazines. These publications include surgical, oncological, academic, and anti-aging topics. He's the author of the books The Migraine Cure, The Dzugan Method, Restorative Medicine, Your Blood Doesn't Lie, The Magic of Cholesterol Numbers, The Restoration of the Human Body, and The Menopause Cure, Hormonal Health, and is a holder of 3 patents related to heart surgery. He's a member of the editorial board of Neuroendocrinology Letters and a member of the medical advisory board at Life Extension Magazine. And on numerous occasions, he has presented his work at the prestigious International Congress on Anti-Aging Medicine. Dr. Dzugan, thank you so much for joining us here today.
Thank you very much, Taylor. It's nice to see you first, and second, thank you for the invitation to be on your program.
Absolutely. And our mutual friend, Michael, who's a very good friend of mine, he's been talking to me about you for many, many years. He talked about how you changed his father's life, you changed his life, and it was all by optimizing different things, including hormones, which we'll talk about here today. So maybe let's start with a little bit of a background of why did you get into, you did many different things in medicine. What led you to this field that you have now been focused on for, I don't know how long, the last 20, 30 years, hormones?
Basically, a little bit more. I completed medical institute back to 1979, and I use in my practice different vitamins, different supplements, different hormones when I was cardiovascular surgeon and heart surgeon at the latest stage of my professional life. And when I relocated to the United States back to 1995, I was surprised that in United States we use strange word supplements because as for me, all these so-called supplements were medicine because we spent 1 year of training in medical institute in pharmacology, and we study all hormones, we study different supplements. Also, we compound different prescriptions by ourselves because we were trained how we can put together, for example, some formula for skin, for example, like zinc and magnesium and other things, and we basically give prescription. We compound it with prescription, all these things. That is why when I came to United States, I was first a little bit surprised that some supplements not medicine. Like, for example, when you have deficiency of vitamin B1, what is the main medicine? It's vitamin B1. If you will not use it, you will have very disease. Or if you have deficiency of vitamin D3, you'll get problem with your bones. So what is the medicine? Of course, vitamin D3. That is why you cannot say that it's supplements, it's just vitamins for nothing. That because all of them are very important for normal functioning of the body. And as first step, I was invited to work as scientific advisor to cancer clinic, to oncologist, Dr. Arnold Smith. He was owner of cancer clinic, and he asked me to work with cancer patient and try to find way increase survival, 5 year survival rate. And all our patients use different hormones, different supplements, because quite often when you have cancer, you are in wasting phase. So your patients start to lose weight. So it's so-called catabolic waste stage. And what we try to do, we try to use some anabolic or building hormones that help restore body mass, because cancer doesn't kill patients per se. It usually creates starvation cycle in each cells, and the cells dying from starvation. Again, it's maybe a very rough explanation, but this is how it looks. Because again, cancer doesn't kill per se. It creates some bad physiology. Because let's explain a little bit what physiology is, and you'll understand why we try to work on physiology. Physiology is the science that explains how our body works on daily basis, how our functions, different functions of our body, how our organs function. So we have so-called normal physiology when our body works optimally, and we have so-called pathological physiology. And pathological physiology basically teach you as a doctor what you can expect from functions of different organs, how this function changes, how blood tests change it, and you can regulate all the things. That's why we spent 1 year in medical institute. We learn first normal physiology, then pathological physiology, and that is why every time when we have deal with pathological physiology, what we try to do, we try to restore optimal functioning. We try to return to normal physiology. And when we talk about physiology, it includes, of course, hormones. It includes different so-called supplements, like different microelements or some nutrients and vitamins. And we try to apply all the things on the whole body functioning. And basically, if you will ask question, what is physiology? What is health? Health is optimal physiology. And what we try to do with our medicine, we try bring physiology back to medicine, because unfortunately conventional medicine is oriented practically strictly on drugs. And we would like to use natural way to help patients. And many things that bring me to point that we need to use this method of physiology restoration and then optimization. The fact that you know that a population of United States makes up only 5% of population in the world, but we consume over 50% of the world pharmaceutical drugs. It's crazy.
Wow.
Prescriptions drug now killing far more people than illegal drugs, for God's sake.
Yeah,
Americans also consume 80% of global supply of pain pill. And even worse, we know that more than 25% of kids in the United States use prescription drugs on a regular basis, and American kids consume more than 85% of all psychotic drugs. It's just crazy situation. That's why we need to pay attention to our health and our future, because kids are our future. Another fact, for example, we know that percentage of women taking antidepressants in America is the highest in the world. So it's crazy situation. So what we try to do with our approach, let's look what happened, for example, in Africa. Every morning, gazelle waking up knowing that it must run the fastest lion if it wants to stay alive. Every morning, lion wakes up knowing that it must run faster than the slowest gazelle, or it will starve to death. It makes no difference whether you're lion or you're gazelle. When the sun comes up, you had better be running. And this is exactly what we try to do with our patients. Another few facts that can describe and help understand what we do, like if you'll take aging, what can we expect during aging and why. We all started out the same. Kids have the same size and shape, same size of shoulder. They have similar faces, hip size, everything looks the same. Even the habits, for some reason, the same. And then in certain period, is basically during puberty and a little bit later, suddenly switch was flipped in on position and we became different. So when you look on men and women, for example, in age 20, you do not need guess where men were women. They do not look similar anymore. Breast, shoulders, hips, waist, everything changed. And these people around age between 20 and 30, they have plenty energy, unlimited power, quite often happy. Of course, they didn't make enough money. And I watched one your interview and you told that after 30 you start to have all this problem. You're absolutely right. This is like break between good feeling and bad feeling. Age 20, 30 is the best, healthiest group in population if you take any other groups. So with all this plenty energy, good feeling, with everything, we think that we will live forever, but we are wrong. Another change happened around age 40. That is why we insist, in many cases, patients start to use different supplements and check hormones if they need around age 40. Because age 40 visibly changed person even physically. Once you look down on yourself from the top and you cannot see your feet, in front of your eyes only your stomach is present. With all problem in life, there are one more. Now it cramped behind the wheel and sex turns in sumo battle. So you're fighting. You're not enjoying sex. You just have like struggle with yourself and with your partner. So and what happened again around this age? Your hair starts to begin gray. You start to have more wrinkles. Definitely your quality of life decrease and you start to have fatigue and short-term memory. You came to the room, you forgot why you came in. You check if you switch off lights in your house, and et cetera, et cetera. You start to forget about all these small things. And you need to remember that time during aging is not your real friend. After you passed 40, you became slower, weaker, sicker, less attractive to potential mates, and less full of life and vitality, basically. And then age 50, what happened around this age? We look like kids again, absolutely same. We have same faces, we have same breasts, we have same fat stomach, we have big enlarged hips, we just start to lose some height because some problem with health of your vertebrae. So what happened at this time? Switch was flipped in off position, and we start to collect all this aging problem. High cholesterol, diabetes type 2, high blood pressure, fatigue and tiredness, insomnia, different psychological issues, depression, migraine, fibromyalgia, Parkinson, Alzheimer disease, menopausal problem, erectile dysfunction problem, and other problem.
Yeah.
So,
and what you guys do, your goal with optimization, right, is to turn the light switch back on for those people in their 40s, 50s, 60s, 70s, and above. I know there's literally on your website, when I went years ago when Michael first showed it to me, I mean, you just had testimonial after testimonial after testimonial, women going through menopause that said, I could barely get out of bed. And then after going on Dr. Dzugan's program, I'm now feeling better than I've felt since I was in my 20s. And, so many different testimonials of people that you've helped optimize and turn the switch back on. So how do we do that? How do we turn the switch back on?
Yeah, definitely. If you want to improve our condition, the number one question that we need to get answer on: what causes disease? Because if you don't know cause, you always will use something for improving one symptom, another symptom, and unfortunately, when you use something for one symptom, you can get problem with another thing. That is why when we wrote a book, Your Blood Doesn't Lie, we suggested some very simple, some sort of classification. We said that disease can be caused by just one of four factors. You can tell, wow, just four factors? Are you kidding? There are 1,000 different diseases and conditions. But we think that a such small division of different diseases may help easier to understand what you should do. And first factor is genetic and congenital. Different conditions like hemophilia, Down syndrome, congenital heart disease, sickle cell anemia, they clearly have genetic or congenital causes. Then different infections. Diseases clearly caused by infectious organisms such as viruses, bacteria, fungi, protozoa, and other. Then number three is trauma. Any physical trauma can cause brain hemorrhage, for example, or post-traumatic epilepsy, or brain injuries and other conditions. But the final and major causes, we name it so-called acquired physiologic errors. Acquired physiologic errors. Many diseases under this umbrella. And the majority of people usually have disease that have one or more or caused by acquired physiologic error or imbalances. Conditions such as heart disease, cancer, arthritis, depression, fibromyalgia, migraine, fatigue, ulcerative colitis, atherosclerosis, and many other basically fall under this category. And we believe that error of physiology are the root cause of disease and affect all our organ and system: skin, eyes, cardiovascular system, digestive system, muscle and bones, brain, immune system, gynecology, everything. And based on this statement, we formulated the main principle, how we can treat these patients. We have one cause, acquired error physiology. So any kind of damage in function or wrong function that we collected during aging, it's one cause, and so we need just one solution, or one disease, one treatment approach. And we believe that method of restorative medicine is the answer for our concern, because it treats error of physiology by restoring the body's hormones and nutrients to optimal level. And this restorative medicine approach is effective for the diseases conditions caused by physiologic errors, because they're all basically the same disease. You can tell, how can heart disease and cancer be the same as migraine or arthritis or depression or Alzheimer's disease? We propose that they're all fundamentally the same, because they're caused by the same problem: physiologic and hormone imbalance, including deficiencies of important vitamins and minerals. And that is why we wrote this book, Your Blood Doesn't Lie, where we explain the principle of physiology optimization. And we claim that many conditions are actually quite similar, because they have similar causes, deficiencies, and balances. That is why when we work with patients and restore, for example, a level of hormones, first we restore level of hormone that will be inside of normal range, and then we optimize, because better to understand what we do. For example, normal range for pregnenolone hormone was for many years from 10 to 200 for men, and from 10 to 230 for women. And if you level 11, your doctor can tell you're fine. You're in normal range and you do not need pregnenolone. But the problem is, patient will have severe short-term memory problem, severe long-term memory, because pregnenolone is grandmother of all steroidal hormone and has memory it's hormone that improve our memory. Every time when we lost production of pregnenolone, we start to have memory issues, and we start to have different pain, like inflammation problem and back pain, joints pain, because pregnenolone has great anti-inflammatory function also. And basically, around World War II, pregnenolone was #1 prescription medicine in the United States for rheumatoid arthritis. And then when we suggested synthetic steroids like prednisone, so we just completely ignore what our mother nature basically recommended to use.
Yeah,
What our
and
body
I love the
produces.
name of the book. I love the name of the book, Your Blood Doesn't Lie, because it's interesting to me to this day still. Many people don't even get a blood test. People in their 40s, 50, they barely ever get a blood test, or maybe they go to, oh, this is what I can get for my normal yearly checkup. Just, very basic things. Like you said, the doctor will say, oh, you're within range. If the range is 10 to 230, you're 11, you're within range. So
Right.
what's the difference between like a normal generic doctor blood test versus what you are doing? I know your patients, I believe, probably would want to get a blood test at least once every 6 months, and then you can kind of see the changes, and then you're making recommendations, and you need to have the blood test in order to optimize. Otherwise, people are just guessing, right?
You're absolutely right. Yeah, we cannot do anything blindly. We cannot. When you have vision problem, what you do? You just came to ophthalmologist or some optometrist, and they will check vision, and they will tell, this is prescription what you need, right?
Yeah.
Right. If you will try to just request some prescription glasses because you think it will fit to you, probably it will not fit. Or you can even make worse your vision. That is why you need to know first what you had deal initially with, and then how your program changed your levels. Because, for example, a person that have absolutely identical height, weight, age, even blood test, same as you have, and we gave identical program for you and for other person. In your case, it will work perfectly. You will not need any correction, but other person will need several times adjustment. That's why when we work with patients, first we have systems that allows our patients update us 24/7, and we usually respond every time when patients update us. And we always said that if you want to get good results with your treatment, communication is most important thing. Because if you will start to do program, and because doctor said, see you in 3 months or 6 months, during first week can happen something that you will not like. Like, for example, you start to use estrogens, and you start to have breast tenderness or nipple soreness, and you will be angry with doctor, and you will stop your use of estrogens. And, but if you will update us, what can be done? Dose of estrogen can be decreased, or progesterone should be increased. So it depends again from each single situation. Please remember that we are unique in this universe. So each person requires individualized program. And this is exactly what we try to do. And many times, this is what, again, what we need to remember. Unfortunately, many conditions, we cannot say that they diseases. And we use so-called syndromes like fatigue syndrome, metabolic syndrome, attention deficit hyperactivity syndrome, alien hand syndrome, or restless leg syndrome, restless genital syndrome. So what syndrome means? It's basically what doctor did. They describe several symptoms under umbrella of this syndrome, but they have no idea what cause of this. Like many patients who have attention deficit hyperactivity disorders, they quite often have problem with so-called neurosteroids. Neuro means brain, and your neurological system. Neurosystem requires basically natural agents and these aging hormones that can work with your brain and neurological system. And quite often we saw that patients who had depression, social anxiety disorder, attention deficit hyperactivity disorder, they had problem with progesterone, and male and women. Because for some reason, doctors quite often ask, why do you use, for example, progesterone for men? We are human. So our body, men's and women's body, produce the same hormones on only different amount. That is why we need to pay attention to all malfunctions, all possible reasons for problem. And quite often, like I said, these neurological disorders, they require restore pregnenolone, progesterone, sometimes DHEA. Quite often patients have, for example, higher testosterone or normal, but on higher side of testosterone and no female hormones. So what happened? This child screaming, running, destroy everything. So he's happy that he can do whatever he wants. And he got diagnosed attention hyperactivity disorder. And when you check blood tests, there is no progesterone, there is no estrogen. And normal, absolutely normal, but higher level of testosterone. So it's imbalance. So there is no calming or cooling effect of natural hormone. That's why it's always need to look what is going on. When we have deficiency of, for example, thyroid or insulin, so we quite often immediately go to these drugs because to these hormones because a person can die quickly. But when you have deficiency pregnenolone or estrogen, especially during aging, or progesterone or testosterone, who cares? You will not die fast. You will die slowly with multiple deteriorations, with all these damages. So you will start to collect all these old crampy conditions that you do not like. That's why it's always better to look the whole spectrum, at least foundational hormones that came from cholesterol. Because we think that cholesterol is so bad guy and we're crazy about all this good number, but
I wanted to ask you about cholesterol. I know we have cholesterol for me is such a controversial topic. You have some people who just say, oh, cholesterol is going to, you have high cholesterol, you must get on statins, you must do these kind of things. I've heard other people, I think yourself, I believe you are not a fan of statins. Tell us what you think about cholesterol and what you think about statins.
First, most people know only one thing about cholesterol. It's so dangerous substance in our body that it should be removed by any way. But the truth is, we cannot live without cholesterol. And when patients have low level of cholesterol, they have very high risk of cancer in very young age. And I mentioned that, or you mentioned that I work in cancer clinic for seven years. And every time when we saw young people in age around 40, practically 98% of patients' cholesterol level was low.
Wow.
And what happened when a cholesterol level is low, and why we have this problem? Because your doctor never told you that cholesterol is source for over 60 steroidal hormones. But when we said steroidal, it's not bad word. It's just meaning that it came from cholesterol. It's group of hormones, over 60 hormones came from cholesterol. Testosterone is steroid. Testosterone, natural. Estrogen, steroid. Cortisol is steroid. Progesterone is steroid. Pregnenolone, DHEA sulfate, DHEA, androstenedione, vitamin D3, everything what I name, they're steroids. So we cannot live without these hormones. That is why when patients have low level of cholesterol and why they have cancer, because majority of hormones have anabolic effect or building effect. So every time when you have any damages of cells or dead cells during aging, your body tries to restore it. Your body tries to replace it. Your body tries to build new cells. That's why you need all these hormones. Why we collected all this aging changes? Because after age 35, it's like crucial moment in our life. Catabolic processes or destructive processes start to have dominance. Like, for example, we have two different important hormones, cortisol, stress hormone cortisol, and DHA. They work together like twins. So DHA controls cortisol, cortisol controls DHA. They work as a twins. Same thing like androgens, male hormones, they in balance with female hormones. Different balance in men and women.
Yeah.
When we talk about females, estrogens, progesterone, it always should be balanced, or we will have problems.
And that's I think, something very interesting about what you guys do is, so many people are just like, men especially, I want higher testosterone. Well, you need a balance, right? You need to look at the whole picture. So many people just looking at one piece and not looking at, well, this has to be balanced with this. And so it's I love how you guys are doing that. And then what is your thought about statins? Are they one of the most overprescribed drugs for cholesterol, and could people do some? It sounds like you would rather someone have high cholesterol than low cholesterol, right?
Yeah, basically around 2000, there is beautiful study was done in Hawaii, and doctors took several groups, patients who have cholesterol level less than 160, then level between 160 to 100, then 200 to 40, and more than 240. And the best survival rate was in group from 200 to 240. The worst survival rate was when cholesterol was less than 160.
Wow.
On the lower side.
I'm happy to hear that, because mine was 220 on the last test. So I'm happy to hear that.
Yeah. Okay. What we do, we use cholesterol as a marker. It's like a thermostat. It's same thing like when you have fever, what fever tell you? That you have some infection and you need to do something. Why cholesterol elevates during aging? Because production of majority hormones start to decline. What our body tries to do, our body wants to live normal life, is try to restore useful, normal, good level of hormones. And what source for these hormones? Cholesterol level elevates. What happened during pregnancy? Cholesterol elevates up to 350. No single doctor in the world will give statins to pregnant women because we know that we will kill baby.
Wow.
And why cholesterol level elevates? Because woman needs much more hormones for two, herself and baby. Woman needs much more building material for two, baby and herself. That is why probably it's answer for you, what do I think about statin drugs? Like I said, cholesterol number should be used as marker or thermostat. And when you do application, you can tell, okay, this is what I did with my program. Like, for example, we did study basically and publishing in medical hypothesis back to 2002 about cholesterol. We suggested new hypothesis. So we said that elevated level of cholesterol is compensatory mechanism for decline production of hormones. And what we do in this case, we check most important basic hormones that came from cholesterol, and we try to optimize them. And when we optimize them, cholesterol level decreased. We do not suppress cholesterol. We just restore hormones, cholesterol decreased by itself. When you use drugs, you suppress cholesterol and you suppress even more hormones that you already have deficiency with. That is why we need to be very careful with all this thing, with cholesterol. Of course, we need to remember that cholesterol can elevate not only because your hormones are not optimal, but because our body uses cholesterol for production of bile acids, vitamin D3. So if your vitamin D3 will be low, so your cholesterol level can also elevate. And cholesterol is number one repairing material. Each cell's membrane consists cholesterol, and cholesterol serve as repairing material. So if you, for example, had surgery and you have wound, so your cholesterol level will up. Why? Because your body tries to heal your damage of skin and subcutaneous tissue, muscle, all the stuff. So if you're very sick and your cholesterol level elevates, it's good because your body tries to work with some damages in your body. That is why, again, we always need to understand what 4 different substances that our body produces. Why cholesterol elevates? Why blood pressure elevates during aging? So you need to get answer on these questions. But again, when we talk about our program and we talk about acquire error of physiology, so what we try to do, we try to do nothing. We just try to optimize your missing normal physiology. So we try to convert pathological physiology to normal condition.
So,
and another thing, maybe I will add confusion, for your auditory. Not very many, again, people know that cholesterol is not fat. Quite often it has name lipid, steroid, sterol, fat, but it's not fat. It's look like combination of steroid and alcohol. Also, it does behave like alcohol. And basically, problem is biochemists did not define yet exactly what molecule of cholesterol means. That is why when we measure cholesterol, we create it so bad, not understandable measurement that I cannot even describe. It's same thing like when you would like to know how many apples you have by adding 5 plums, 4 pears, and some 20 cherries divided 5, you will be confused because you'll tell there is no apples here. But this is exactly what we do when we measure so-called cholesterol in laboratories, in blood laboratories. There is a lot of confusion. So I think that because big business involvement, nobody has any interest to clarify all the situation because knowledge is power. As soon as many patients will know what is going on, what you have deal with, what you try to measure, and what is real measurement. So quite often people will ask, do I need to use something that can damage my body?
Yeah. And statins are one of the biggest money maker, for the drug companies. And so, it's really unfortunate, in my opinion. So what do you think? So some people will be saying, well, so how do I know what causes heart disease then? Heart disease is the #1 killer in the US, I think. What does cause heart disease then?
Basically, heart disease didn't start, or atherosclerosis process that usually we found in arteries and your heart coronary arteries and your brain arteries. It didn't start process. They didn't start process. Cholesterol didn't start process. It's ending phase of some problem. So what happened, like, easy understand. If you'll take, for example, arterial wall. Arterial wall has 3 different layers. One layer internal intima, then muscles, and then some sort of coverage of this artery. So process usually starts in intima, between muscles and intima. We have some how we can say this in English, plate, I will say plate, that divide muscles and intima. And what happened during aging? Production of anabolic hormone. such as testosterone, DHEA, androstenediol. So they start to decline. And what happened, your muscles in arteries became weak. But as you know, arteries move all the time. It's dilated, it go in some constriction phase. So when you have weaker muscles, so your arteries can dilate more, and it can give you micro trauma to your intima, and you will have some sort of scratch. When you have this some sort of scratch, what your body tries to do? Your body tries to heal. And what is number one healing material? Cholesterol. So cholesterol is coming here. Platelets came here.
Many people will argue, sometimes people are afraid. Many people are still afraid of hormones, even hormone optimization. They're afraid. They say, well, isn't it going to, doesn't higher testosterone or hormone, taking testosterone going to, I'm afraid of getting a heart attack. I'm afraid of getting, prostate issue or something like that. Everybody's afraid. What is this misconception then about hormones?
Okay, first, if you talk about testosterone, so what do we know? Our heart has more testosterone receptors than any other organs.
Wow.
It's big muscle pump and requires support on daily basis. Of course, if you will not check your blood test initially, of course, if you will use wrong dose of testosterone, of course, if you will use not physiological approach to the use of testosterone, you may get problem. Because, for example, how our body produces hormones. In the morning, your body produces most hormones between 6 and 9 a.m., the biggest amount of hormones, then middle day less, and the lowest level in the evening. Next day, the same. Quite often, for example, doctors use injection of testosterone one time per week or one time per month, or use some pellets that stay in your body for 6 months. And you will have super high physiological level of testosterone. It will not fit, it will not mimic your natural physiological cycle. That is why what we talk about respect what Mother Nature creates. Like we have day and night. We have sun and moon. We have change of seasons 4 times per year, every time. It's no matter you produce hormone, not produce hormone, but your body follows some cyclicity. That is why when we use, for example, some hormones in female and women do not have menstrual cycle anymore, we use artificial cyclicity because we try to mimic normal physiological cycle. And we try to restore communication or feedback loop mechanism, negative, positive, between organs that produce hormones and your hypothalamus and pituitary gland, 2 common centers in the brain. That's why, again, it's complex. And when if you will back to, again, to heart problem and use testosterone, when you use appropriate dose of testosterone, when you follow normal physiological cyclicity, when you understand that your testosterone may convert to dehydrotestosterone, and dehydrotestosterone, many doctors said is bad testosterone, but again, it's not bad. Our body doesn't produce anything bad. What happened during aging? Why our body converts after age 40, quite often more testosterone to dehydrotestosterone? When we have, in young age, we have balance and normal level of testosterone, weaker testosterone, and much stronger dehydrotestosterone. So during aging, production of testosterone starts to decline. So your function related to testosterone starts to decline. You start to have less morning erection, you start to have less strength of your muscle, you're tired more quickly. So what your body tries to do, your body tries to compensate deficiency of these functions by extra conversion of weaker testosterone to stronger dehydrotestosterone. And dehydrotestosterone may support your function of your heart, of course, and your sexual function, your muscles, everything, but it can create problem for as enlarged prostate. But again, another thing what we need to remember, dihydrotestosterone has specialized dihydrotestosterone receptors in bone marrow. So your bone marrow produce enough red blood cells, white blood cells, platelets, because the dihydrotestosterone. That's why when we talk about not just hormone restoration, we talk about physiology optimization. When we said this, what I meant. So we gave testosterone, and we know that we need control some enzymes that control conversion of testosterone to dihydrotestosterone. And we give saw palmetto, we give zinc, quite often we give progesterone. It's control extra conversion to dihydrotestosterone. And when I work in this private cancer clinic, quite often we use with Dr. Smith pretty good dose of progesterone for patients who have enlarged prostate. And usually in 4-6 months, when we use enough progesterone, usually this enlarged prostate shrink and patients feel better and urinate better. That's why, again, every time when you try to do, you need to get answer why I need to do this, how our body tries to do it. Like again, I mentioned elevated blood pressure. Why blood pressure elevates in most aging people, not young people, in aging people? Because stiffness of arteries, but we continue to use enough oxygen and nutrients in the brain. If we cannot, so our body try to pump harder, try to give more pressure. That is why for all patients who have elevated blood pressure, we always recommend it to do light exercise and walking. Light exercise like move hands, move arms, because muscles usually is the biggest obstacles for normalization of blood pressure, because all these capillary and arterioles, they in constriction phase and they require elevated blood pressure. But when you do this light exercise, cost nothing, zero. It's not basically drugs that cost some money. You just move it, not sit in front of a computer and talk with Taylor.
That's right. Well, I love what you just said, though. I want to go back because a lot of people, when you hear of people taking testosterone, for again, many men in their 40s, 50s, and older need some testosterone. But what you said was very interesting. And I know that with you like the testosterone cream because like it follows a natural cycle. Every morning you wake up 6 to 9 a.m., your testosterone's higher, you put the cream on versus doing an injection once a week. People say, oh, the injections work better. I feel it more. You know, this is the rumors you hear a lot of people saying. But like, I agree with you because it's not natural to have your testosterone shoot up for 2 days, then maybe come back and normalize. Then it's low again. Then you have to take another shot and you shoot back up. It seems like, and actually I heard someone who does take injections and he said, what completely changed it for him was when he started doing smaller doses, but injections first thing every morning daily. But who wants to inject themselves every single day, right? Nobody likes that either. So the cream makes a lot of sense and following the natural rhythm and restoring. You're not doing anything artificial. You're restoring what your natural levels are when you're in your 20 to 30-year-old, when you're feeling the best and have the most energy and everything is in the optimal range, right?
Right. I completely agree. Very few patients who, when we use cream or gel, testosterone gel, we didn't reach the desirable level. Very few patients. And quite often in such case, we can try to use like troche or lozenge. It's some small of like tablet that you can put under your tongue and dissolve it, because your tongue has a good blood circulation. Because if you will swallow pill, it will go to your liver, and definitely we do not want any usages of this barrier against this hormone. That is
so
why
this is fascinating that you know the whole concept of also your heart is a muscle, and if you're very low in testosterone, the muscles need an optimal level of testosterone. So yeah, so it's really interesting, this concept. I haven't heard that before.
Taylor, even one more just for your thinking. There is some information that bald men, they have much more frequency of heart attack, and baldness related to low level of testosterone. So it's converted to dehydrotestosterone.
Mm-hmm. Interesting.
That is why, as you can see, importance of testosterone is huge, because bald man means almost in 100% problem with total testosterone. The hydrotestosterone can be normal or higher. But again, the hydrotestosterone has very high potency. And around, I believe, 2000, many anti-aging doctors use the hydrotestosterone gel for the treatment of sexual dysfunction in men, because the hydrotestosterone has much higher potency. But people start to lose some hair. Then quite often problem was with hematocrit and with red blood cells and platelets. So I don't know, probably nobody use now the hydrotestosterone. But again, what you need to do, you need just optimize your normal relationship between all other hormones.
Yeah. I mean, some people, I would say hair loss might be genetic, though, no? I mean, people who go bald when they're 25 years old, 30 years old, there must be some genetic component to this as well, I think, right?
Of course. Yeah. And genetic component that usually describe that that you have some problem with production of testosterone. Very brief example. I work with some patients who have basically congenital issue with elevated level of cholesterol, and each doctor said it's genetic. I agree. So if genetic, you cannot help, right? You cannot help. Yeah, you can try to suppress cholesterol with statins, with other drugs, but basically you do not have anything. When I work in Life Extension Foundation, I had two employees, and both fathers of these employees, they had congenital hypercholesterolemia. And when we checked blood tests, what we found that they have complete disaster with hormones. And also I have husband of nurse. He was 35 years old. He had like cholesterol and triglycerides over 1,000, cholesterol very high, 300 plus. So when we did blood test, we found that he had deficiency of hormones. And when we restore hormones, what happened? He donated blood. And suddenly when he donated blood, they checked cholesterol and they found that he had 209. So he never ever had such level. So then we start to think, okay, probably a genetic problem, not just with cholesterol, but with hormones, so-called steroidopenia, or low level of steroidal hormones, that basically trigger normal optimization from cholesterol, because cholesterol, again, evaluate situation, see all this deficiency of hormones that genetically were set up to this gentleman. So they see cholesterol or liver or brain see that there is low level of hormones, so it's try to produce more cholesterol as building material for hormones.
Yeah.
Again, it's very complex, and
it's very complex. I could talk to you about it for hours, Dr. Dzugan. This has been really, really amazing. I want people to learn where they can learn more from you. Is the website dzlogic.com? Is that the best place for them to go to?
Yes.
dzlogic.com. And I think they can do like a consultation with someone there. And then if they want to move forward and get a blood test and have you guys do an analysis there, and then you can optimize for them. And you have been really a pioneer in this hormone industry. Now all these telemedicine clinics, all these, any guy who lifts weights and takes testosterone, can open his own telemedicine and start telling people they should take testosterone. I've seen a lot of that going around. but they don't know how to optimize. They don't know about all these other nuances and all the things that you're doing. So I highly recommend, and I know firsthand, I've seen people who have gotten amazing results on your program. So highly, highly recommend everybody go check out dzlogic.com, especially if you're over 40 and you're feeling like, something's not right with you. Very, very important. It can be an easy optimization. And for me personally, I think it's even more important than people realize, because if you start to feel bad and then you just go to your regular doctor and then he gives you a prescription, now this prescription could cause another side effect. Now you need another prescription. And once you start going down this path, it's really not a good path,
I agree with you. Yeah, I agree. And very important, you mentioned again testosterone, because probably you have a lot of questions about it. But I would like to ask all people who listen to you that they should be ready to run marathon, not sprint. Because when you use, for example, something that will pump a lot of something that will make you immediately like hyper and powerful and everything, and then you'll start to decline. Then you'll start to pay basically price with even bioidentical hormones if you use higher dose.
Yeah.
That's why we need to remember that life is not sprint, it's not dash, it's marathon.
That's right. I love that. Dr. Dzugan, this has been amazing. Again, I could talk to you for hours. You're such a wealth of knowledge. I know you speak on many of these very high-level conferences, and you speak to doctors, and you train other people. And we can't thank you enough for all the work that you're doing, and highly recommend people go to DZ Logic. Thank you so much, and I hope we can do it again sometime.
Thank you, Taylor. Thank you very much. It was a pleasure to talk to you.
Thank you. It's my pleasure. Thanks for listening. If you enjoyed the episode, can you please leave us a rating or review and subscribe? I've realized that while we have actually increased our downloads a lot, we're actually getting a lot of downloads, which I'm really happy about. We actually have very few ratings. And I realized that I've never asked people really to rate much. So I'm asking you now if you could please rate and review and subscribe. And if you enjoyed the episode, please forward it along to anyone that you think will get value out of this. Also, if you haven't checked out our line of products at buypeakperformance.com, you get 20% off your first order. That's www.buypeakperformance.com. We have some incredible products, including our organic high-altitude coffee. If you don't know this, coffee is one of the most heavily sprayed with pesticides out of any crop. So it's really important that you drink organic coffee. We've gone above and beyond to source what we believe is the highest quality and healthiest organic coffee in the world. We're also famous for our organic green superfood powder. You can get 20% off of that as well at buypeakperformance.com. We also have an organic vegan and paleo plant protein. See, most of the vegan proteins out there are using brown rice protein, which is really not a good source of protein, and it's also a grain. And if you're paleo, you know that grains tend to cause inflammation in some cases for some people. And so we wanted to make one that was paleo friendly and vegan and organic. We made an amazing amino acid profile, so it's really one of the best plant proteins for muscle building. So you can check out Peak Performance Organic Plant Protein. You can find that on our website. Of course, all our products are on Amazon as well. So thanks again. And again, please, if you enjoyed the episode, please forward it along to someone who you feel can get value out of it. And please leave us a rating, review, and subscribe. Thank you.